paradigm, which is it's a tell-time task. The idea is that it's a very simple task. Everybody has looked at their watch probably many times per day, so it's a task which doesn't require any training. And the idea is that audio, essentially the time is spoken through headphones, and simultaneously two clocks are presented, and the subject has to pick the one which is not the same as what was spoken. And this task is simple, but at the same time it involves activity in many areas of the brain, because it's both visual and auditory. It requires attention. It also requires to suppress it requires actually essentially it's an equivalent of a psychological task, which is it is a so-called countermanding task. So, and this is an example of one subject. So the data, fMRI data is quite noisy, and so it requires multiple repetitions. And after averaging a group of controls, so first I'm going to show activation patterns in healthy control subjects. So the red areas are these are voxels which responded in phase with the task. So when the subject was performing the task, all the areas which are red, there was an increase in bone signal in those regions. But in parallel, there was a set of areas shown in blue here, which actually decreased the responses. And it's a known phenomenon. Actually, it was discovered about 10 years. Brain imaging people discovered that actually there's a very well-determined replicable subset of cortical areas which always are suppressed when people pay attention to the outside world. And later it was discovered that actually it's that those areas belong to a network which is currently called a default mode network. And the areas in this network are involved in self-referential processes, essentially in self-reflection, moral judgment, replay of past, significant past events, and also planning of one's future. And also, a part of this network is hippocampus. So essentially, the hippocampus is known to be a memory system. This is the key component of the memory system. And actually, it's a quite recent development that turns out that the default mode network also is involved in memory. And so the task was designed so that we could look at both the response to a single trial of the tell-time task and also at the block. So you can see that there are two responses. One is transient response to a single task, and then a larger response to a larger response to the block. And you can see that there's this characteristic undershoot, which, according to balloon theory, should be responsible for the Venus, delayed Venus outflow. And so all the red voxels contributed to this response here. And now this response is actually an average response from all blue voxels. As you can see, it's almost exactly reverse of this positive response. So this is just a zoom in on the general the response of all the red voxels. So when we look at when you look at the first MS patients before angioplasty procedure, one of the things which popped immediately out was that was this larger undershoot in some patients, not all of them. But this was really salient, so we thought maybe it can be used as a diagnostic feature. So now, so these are group analysis maps. These are significant maps, T maps, for control group that you saw before, MS patients and the difference. So, as you can see in MS patients, there are fewer reddish voxels. So overall activation is lesser in this case. But the most salient feature here is that control show this very nicely defined default mode network, while MS patients show very little. So essentially the default mode network is not being suppressed in MS patients here. And when we look at the difference, indeed we see a lot of blue areas which suggest that, again, default mode network is not being suppressed during task performance. But also lots of red voxels which show that overall task related activity is also lesser. So this is just zoom in at that's a difference again of the two groups. So this default network, as you can see, is very well defined. It's very characteristic, and it shows up in many states. Now, when we plot the hemodynamic response functions for control group versus the MS patients, we can see that there is this undershoot, which seems to suggest that MS patients have altered hemodynamics not only in large extracerebral veins, but also internally in the cortex where all the neural complications are occurring. Now, let's look at what the angioplastic procedure can accomplish in terms of neural activity. So again, this is the same map before. So now we're looking only at MS patients before angioplastic intervention and afterwards. And as you can see, there is after the procedure, the default network is back, essentially. It's completely back, and the difference shows. So what the difference shows is that, well, first we can again see the default mode network, but also there is a little bit of reddish voxels, which means that overall the activation in cortex seems to increase. And then if we look more quantitatively at individual, essentially we can count, we can use voxel count as a measure of activation, of overall activation. And so let's focus on this for a moment. So the first bar is the control group. And MS patients before the procedure and after, there's a slight trend that overall there's a slight increase in total number of active voxels. These are task positive voxels, meaning that all voxels which were evoked by the task. Now, and this actual trend is not really significant. Actually, I should elaborate on that. So the overall effect, so ANOVA is significant, but this effect is not significant. But if we look at the task negative, the blue voxels, we can see that, well, first, there are fewer voxels in MS patients, but the count comes back to normal after the procedure. And these are just examples of individual areas. This is the cerebral cortex, and this is medial frontal cortex. You can see significant effects. now when we look at the hemodynamical function for the average of all task-related voxels, so there's a slight trend after the angioplasty, so we reduce the undershoot. And some areas don't show anything after the procedure, but some other areas show more significant effects of the procedure. And so these plots are of regions of interest in subcortical brain area. And again, if we plot, so let's focus here. So pre-angio is blue, and post-angio is red, and the control is green. So it looks like in this particular region, angioplasty procedure reduced the undershoot, essentially normalized, brought it closer to normal. Well, so we can see that from these results, in MS, hemodynamic responses in gray matter are affected by CCSVI. So it's not just a question of large veins, but the effects propagate all the way to the gray matter, the cortex. And but the significant changes were seen only in some areas, not everywhere. And angioplasty has a tendency to normalize the hemodynamic responses. But essentially, I find that well, the most surprising outcome of this angioplastic intervention is that it alleviates some symptoms of MS, which presumably has to do with structural damage. So structural damage stays there, the people feel better. So it looks like one of the contributors to the neural basis of the alleviated symptoms, cognitive symptoms, is the recovery of default network suppression. So again, these experiments were tapping only into bold contrast. Essentially, it's again this contrast is a complex function of both neural activity and blood flow. So what was needed is actually to disentangle the neural contribution and the blood flow contribution, and we should use a method, the arterial spin labeling, which allows functional. So it can be used just like bold to measure functional responses in cortex and cortical gray matter, and would allow to disentangle neural and vascular contributions.